Good day, everyone. Welcome to our Nloa 1 long test rationalization. And my name is Joseph Abang, and I'm actually handling this situation that is 8.1. That's fundamental concepts of community health nursing. So I've actually prepared 12 questions for this, and the other situation is 13 questions for a total of 25 items all in all. So let's begin with our situation number one. Nurse A is a newly hired faculty of the College of Nursing and is in charge of the course Community Health Nursing for Level 2 and Level 3 Bachelor of Science in Nursing students at the university. He is now reviewing the fundamental concepts of community health nursing. The following questions apply to this situation. Number one, Nurse A defines community or public health nursing as the synthesis of nursing practice and public health nursing in the community. A student was asked by Nurse A to define a community. The student gave the correct answer the correct definition associated to its appropriate proponent when she stated that. So there are four definitions of a community. We have Lundy and James defined a community as a collection of people who interact with one another and whose common interests or characteristics form the basis for a sense of unity or belonging. Letter B, Schuster and Goipinger defines a community as a group of people who share something in common and interact with one another, who may exhibit a commitment with one another and may share geographic boundary. Letter C, Clark defines a community as a group of people who share common interests, who interact with each other, and who function collectively within a defined social structure to assess or to address common concerns. And letter D, Allender defines a community as a locality-based entity composed of systems of formal organizations reflecting society's institutions, informal groups, and aggregates. So here, the question is which of the following is actually correctly attached to the proponent? So the answer for this question is letter C, because your letter A is the definition of community by Allender. Further, letter B is the definition of community by Lundy and James. And of course, furthermore, letter D is a definition of community by Schuster and Jopinger. So they are actually uh, arranged there's actually an arrangement of this one. For letter A, that is specific for the definition of Allender, which is actually stated in situation letter D. And then letter B is the definition of community by Lundy and James, which is actually on letter uh, A. And of course, letter D is actually the definition of Schuster and Gopinger. So the best answer is letter C. Number two, a nurse A provided a follow-up question to his students about the major goal of community health nursing. His students said that community health nursing's major goal is to preserve the health of the community and surrounding population by focusing on which of the following: A, health promotion and health maintenance of individual, family, and group within community. Letter B, health and identification of population at risk rather than with an episodic response to patient demand. Letter C, social justice that entitles all people to basic necessities such as adequate income and health promotion and accepts collective burdens to make possible. And letter D, community vitality and as a result of positive interaction among groups within the community with an emphasis on health promotion and illness prevention. So parang wala talagang nagkakamali nito kasi nga this is a bonus question because I failed to remove letter B, C, and D's indication because letter B is actually the secondary goal of community health nursing, and letter C is focused on the mission of public health, and letter D is actually considered to be an indicator of social health. Therefore, the answer for question number two is letter A. So that is letter A. I've mentioned that one already. Number three, Nurse A presented to his class that according to Maurer and Smith, there are two main types of communities. A student correctly answered an inquiry made by Nurse A stating that the two main types of communities are. So of course that is specific for Maurer and Smith. So when you say rural and urban, so these are the two locations. These are the two most common locations of communities. We have urban and suburban. This suburban is basically a subset of the urban, and rural and urban is basically the subset of again urban. So the best answer for number three is your geopolitical and phenomenological community. So according to definition, There are two types of communities, which is first the geopolitical communities, also known as the territorial communities, which are most traditionally recognized. Furthermore, we also have the second type of community, which is actually phenomenological community, also called the functional communities. This refers to relational, interactive groups in which the place or setting is more abstract and more people share a group perspective or identity based on culture, values, history, interest, and goals. That is letter D for number three. Number four. During Nurses A's class, he emphasized that public health is a science and art of preventing disease, prolonging life, and promoting health and efficiency as defined by whom? Is it Margaret Shetland? Is it Morer and Smith? Is it C.E. Winslow or the WHO? Of course, the answer here is letter C, that's C.E. Winslow. So when I say letter A, Margaret Shetland is focused on the philosophy of community health nursing, which is focused on the worth and dignity of man. And of course, letter B is actually focused on the classification of communities based on geopolitical and phenomenological communities. And lastly, letter D defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So the answer is letter C. Number five, in community health nursing, indicators of health and illness is an integral part of overall health status of the community. Nurse A emphasizes to his class that which of the following are responsible for collecting morbidity and mortality data and forwarding the information to the higher level of health. The keyword here is higher level of health, and we know that the higher level of health is actually our Department of Health. And part of our Department of Health is actually the National Epidemiology Center because that's basically a subset of the Department of Health. And of course, the one collecting the data is the Philippine Statistics Authority. The answer for number five is local health centers, offices, and of course, department. So we have local health centers, offices, or departments are responsible for collecting morbidity and mortality data and providing the information to the higher level of health, such as the provincial health office, National Epidemiology Center of the UH, the PSA, and the local health centers, offices, departments provide morbidity, mortality, and other health status related which was specified in letter A, B, and C respectively. So answer Delta. Number six, Level and Clark's three levels of prevention were given emphasis during Nurses A's discussion, and a student is correct when Nurse A stated that teaching a diabetic patient about hemoglobin test monitoring is an example of what level of prevention? Primary prevention, secondary prevention, or tertiary prevention, or all of the above. So we know that health teaching can actually happen in any levels of prevention. But of course, we know that when you see primary prevention, health teaching, the focus is the patient that you're actually giving health education is actually healthy and does not have any condition at all. And when you say secondary prevention, the focus of the health teaching is about screening and diagnostics. And when you say tertiary prevention, the focus is on the rehabilitation. So you can actually have health teaching here. And of course, we know that if the patient is diabetic, therefore that is on the tertiary prevention. So correct answer for number six is letter C. So primary prevention relates to activities related to preventing a problem before it occurs by altering susceptibility or reducing exposure to susceptible individuals. Secondary prevention is focused on early detection and prompt intervention during the period of early disease pathogenesis. And tertiary prevention targets populations that have experienced targets or injury and focuses on limitations of disability and rehabilitation. So when we teach our patient about hemoglobin testing, that is about the prevention of complication among diabetic patients. So the answer for number six is letter C. Let's have now situation letter B. Nurse B is a newly hired public health nurse of Barangay B. She will start working in the health center of Barangay B 2 days after her confirmation of the position. She started to recall information that is deemed vital in her practice as a public servant. The following questions apply to this situation. Number seven, Nurse B recalled in one of her classes during her undergraduate studies that community health nursing is different from community based nursing in the sense that community health nursing focuses on which of the following: the primary client is the community, emphasizes on managing acute and chronic, the primary clients are the individual and the family, or concentrates on specific groups of people. So the answer here is letter A. Letter B and C is focused on community-based nursing, while letter D is focused on population-focused nursing. Letter A is the answer since CHN emphasizes preservation and protection of health, and the primary client is considered to be the community. Number seven, letter A. 8. Nurse B further reviewed concepts and she remembered about the intervention wheel describes the breadth and scope of public health nursing consisting of 17 health interventions, which of the following best defines counseling as health interventions. A. Identifies individuals with unrecognized health risk factors. B. Seek information and generate optional solutions to perceived problems. C. Established an interpersonal relationship with the intention of increasing or enhancing their capacity for self-care and coping. Or letter D. Helps community groups to identify common problems or goals, mobilizes resources and develop and implement strategies. The correct answer here is letter C, because letter A is focused on screening, because we know that when it say identifies that is focused on unrecognized health risk factor, that is actually screening. Then of course letter B is actually focused on consultation because you are already uh, having your clinic visit. And then for furthermore, letter D is focused on community organizing because you are letting the people identify their problem and mobilize them to implement a specific strategy. So the answer here is letter C. That's letter C for number 8. Number 9. Further, which of the following health interventions is in the intervention wheel focuses on community organizing? Nurse B correctly identifies community organizing as identifies risk factors and connects with resources, optimizes health self-care capabilities of individuals and families, develops alliances among organizations, or identifies common problems or goals, mobilizes resources, and develop and implement strategy. The correct answer is letter D, because letter A is focused on case finding, letter B is focused on case management, and letter C is focused on coalition building. So number 9 is letter D. Number 10. Furthermore, Nurse B recalled that health teaching is included in the intervention wheel, which are the following level of prevention according to Level and Clark. Is health teaching considered to be an essential intervention, yet nurses have major difficulties in conducting such intervention? A. Primary prevention. B. Tertiary prevention. B is secondary prevention. Letter C is tertiary prevention. And letter D is any of the following options. Of course, the answer here is letter A. Because when we talked about primary prevention, this relates to activities directed at preventing a problem before it occurs by altering susceptibility or reducing exposure to susceptible individuals. So, patient here is actually still healthy. They will actually have the nurse will actually have a difficulty in uh, giving the health teaching. It's because the patient will not probably will not actually listen to you. It will become easier for the nurse to develop the health teaching when the patient is on the tertiary prevention, because this patient is already on the rehabilitation phase. So number 10 is letter A. 11. Population focused nursing concentrates on specific groups of people and focuses on health promotion and disease prevention. Regardless of geographical location, Nurse B emphasized that the main goal of population focused nursing is which of the following: A. Promoting healthy communities. B. Emphasizing management of acute and chronic conditions. Letter C. Focusing on preservation and protection of health. And letter D. Reducing the effects of disease and infirmity. So the best answer here is letter A, because letter B is focused on community-based nursing, letter C is community health nursing, and letter D is focused on the levels of prevention. Number 11 is letter A. Let's now have number 12. Community health nursing or CHN practice requires types of data for scientific approach and population. Nurse B identify the types of information sources which is are vital for CHN practice. Is it vital statistics, health statistics, disease statistics, or all of the above? The answer here is letter D, because we know that demographics include vital statistics, and that's actually in letter A. And of course, that also includes census. And of course, for letter B, that is about disease statistics, that is groups at higher risk, focuses on health statistics. And of course, letter C is focused on services providers available, focuses on city directors, phone books, local regional social workers, and list of low income providers or CH nurse. So therefore, the answer here is all of the above. Let's now have the second set of my questions, and that is pertaining to 8.3, that is primary healthcare and DOH programs. Let's begin with situation C. Nurse C has been accepted in the HRH Nurse Deployment Program of the Philippine Department of Health. During their orientation, emphasis was given about primary healthcare as an essential care made universally accessible to individuals and families in the community. For their full participation, the following questions apply to this situation. 25. Nurse C is correct when she states that the theme of PAGE in the Philippines through Letter of Instruction 949 is Health in the Hands of the People by 2020, Health for All by the year 2000, Healthy Philippines by 2030, or Healthy Filipinos by 2025. So the answer here is letter A, because that is the theme. But when you say letter B is focused on the universal goal, which is health for all by year 2000, then choice letter C and D is focused on the mission and vision of the Department of Health. So answer for number 13 is letter A. 26. Nurse C defines primary healthcare as health promotion, disease prevention, health maintenance, counseling, patient education and diagnosis, and treatment of acute and chronic illness in different health settings. The main focus of clients for primary care is which of the following: A. Community, B. Family, C. Individuals, or D. All of the above. The answer here is letter C. That's letter A and B is focused for primary health care, where letter C is focused on primary care. Letter D is not the correct answer of the situation. So the answer for number 26 is letter C, that is individuals, because the question is asking about primary care, not primary health care. Because when you talk about primary health care, that should have to focus on the community. So the answer for 26 is letter C. 27. When Nurse C is deployed to his assigned health station, she recalled that in primary health care, the decision-making process is community-centered approach with its main goal of which of the following: A. Absence of disease, B. Development and preventive care, C. Health worker-driven, or D. Reliance in health workers. So the answer here is letter B, because letter A is the main goal of primary care, and letter C is focused on decision-making process for primary care, and letter D is actually focused on the outcomes of primary care. So the answer for 26 or 27 is letter B. Let's now have number 28. As nurse C rendered her care to her assigned by a community, she recalled that primary health care focuses on essential health services designed to the community that includes which of the following: education for health, nutrition and safe, and water sanitation, locally endemic disease control and EPI, essential drugs, MCN, CD, and NCD treatment, or all of the above. The answer here is letter D, because of course the elements of primary health care includes education for the health, locally endemic disease control, expanded program for immunization, maternal and child health, including responsible parenthood, essential drugs, nutrition, treatment of communicable and non-communicable diseases, and safe water and sanitation, which is basically part of the inclusion of choice letter D. That's all of the above. 28 is letter D. 29. Primary healthcare is guided by its key principles, which is focused on four A's that includes accessibility, affordability, acceptability, and availability. When accessibility is focused, nurses must emphasize that distance and travel time required to get a health care facility and avail such service within how many minutes? 15 minutes, 30 minutes, 45 minutes, or 60 minutes. The answer here is letter B, that is 30 minutes. Of accessibility, that is focused on the distance or travel time required to get to a healthcare facility, and the home must be within 30 minutes from the barangay health station. So that is letter B. 30. Nurse C is mindful that primary health care in the Philippines is made affordable because of the establishment of each of the following agency or organization which determines the affordability of health care. Is it Medicare, SSS, GSIS, or PHIC? The correct answer is letter D. Medicare is actually a private insurance. Letter B is for private employees. Letter C is for government employees, and of course, PHIC is our Philippine Health Insurance Corporation, or also known as the PhilHealth. So that number 30 is letter D. 31. In primary healthcare or page, the point of entry of clients and patients in healthcare system is through each of the following facilities: primary facilities, secondary facilities, tertiary facilities, special center facilities. Of course, we know that the primary entry of the patient in our healthcare delivery system is ideally should be in the primary facilities or our local barangay health stations. 31, the answer here is letter A. So availability is a question whether health services are offered in healthcare facilities or is provided on a regular and organized manner. Thus, in primary healthcare, the usual and ideal point of entry of patients in the healthcare delivery system is via the primary facility. The answer, alpha, for number 31. Let's proceed now to another situation. Nurse D reviewed concepts pertaining to the Philippine Department of Health programs before he assumed his position in the Rural Health Unit of Barangay D. The following questions apply to this situation. 32. Nurse D is correct when she states that current program of the Department of Health in mobilizing registered nurses to serve the unserved, economically depressed municipalities and barangays is which of the following? Nurse assigned to rural services or NARS, registered nurses in health enhancement and local service or RNHEALS, or human resource for health nurse deployment program, or all of the above? The answer here is letter C, because letter A is a program during the administration of President Gloria Macapagal Arroyo, while letter B is the modified program during the administration of President Ninoy Aquino, and during the administration of President Rodrigo Duterte, the Department of Health implement the Human Resource for Health Nurse Deployment Program. So the answer here is letter C. Next, the Department of Health, as endorsed by its Secretary Juan Flavier, established the Traditional and Alternative Medicine Act, or TAMA, of 1997, also known as what law? Nurse stated that it is RA 8423, RA 7160, RA 1891, or RA 9173. Of course, RA 9173 is actually a Philippine Nursing Act of 2002. RA 1891 is the Rural Health Act, and RA 7160 is the Local Government Code. So answer here is alpha for number 33. Number 33, alpha. 34. The Ligtas Tigdas and Pinas programs of the Department of Health focuses on mass door-to-door measles immunization campaigns of the agency in order to stop the spread of measles infection among children. Nurse D correctly computed the target clients included in the vaccination with its target ages from 9 months to below 8 years old, 9 months to below 12 years old, 9 months to below 15 years old, or 9 months to below 18 years old. Of course, we know that our expanded program immunization is actually uh, a newborn up until 8 years old below. So the best answer for 34 is letter A. That is letter A, because Ligtas sa Tigdas and ang Pinas is a mass door-to-door measles immunization campaign with its target age of 9 months to below 9 years old, or 8 years old. 35. Doctor to the Barrio program, or the DTTB of the Department of Health, assures the public the deployment of doctors to municipalities that without doctors who are unserved and economically depressed fifth or sixth class municipalities. Nurse D is correct in stating that the DTTV program shall be for how many years minimum duration in the community? 1 year, 2 years, 3 years, or 4 years. Of course, the minimum is 2 years. That's letter B. It's according to the Department of Health rules and regulations. Next number. 36. The Department of Health is committed in promoting the use of verbal plants in the management of common traditions or conditions in the community. Nurse D was asked by a community resident in her assigned barangay health station about a herbal plant that can aid in managing headache, stomachache, cough, and colds, rheumatism, and arthritis. Which of the following is the best response of Nurse D about the inquiry? Lagundi, Acapulco, Yerba Buena, or Changu? But of course, we know the focus of Lagundi is about cough. Acapulco is antifungal for skin disorders. Yerba Buena is actually the best answer for 36, because Changubat is also focused for the diarrhea. So this is the answer. Lagundi is used for asthma, cough and colds, fever, dysentery, pain, skin, disease, KBS, ulcers, eczema or wounds, and of course letter B is used for antifungal, and Changubat is for stomach ache and diarrhea. 36, letter C. 37. Nurse is aware that there are alternative healthcare modalities available in which the Department of Health is supportive of its practice. Nurse D emphasizes that reflexology is the application of which of the following: pressure on the body's reflex joints to enhance body's natural healing, pressure on acupuncture patients without puncturing the site, or uses special needles to puncture and simulate specific part of the body, or follows the principle of balancing energy. The answer here is letter A. Because letter B is acupressure, letter C is acupuncture, then letter D is pranic healing. So I think that's it. Thank you so much. Congratulations to those who topped this first LT. And thanks so much for your support. This has been Joseph Abang. Thank you so much for listening.